in this society, we're
This is
dealing
a
with
country
health
where
care
we have
for
anywhere
profit.
based on
We
what
put
estimates you
profit
use
before people.
from 40 to 50 to 60 million
The
uninsured and
quality of care in
underinsured
America now is less than what it was
one
when I
fourth
was in the
of
field.
this country's population who lacks
We're talking about
health
people with
insurance, who lacks
social,
access to health care.
economic, family,
If
psychological,
poor people
all
are
kinds
dying,
of
they
things
shouldn't
that
be
come
dying
into the milieu
of
of illness.
illnesses.
That if
Okay,
you don't
they're
address
not
all of them,
receiving the
you
care.
just don't have an
What
individual.
I have found as being a
There are too
nurse
many people in this country
myself, and it just breaks
getting no
my heart
care.
so many times,
This is
that people
a dire tragedy, and it's a shame. This country is a
So what
disgrace
we have
in the
here
world. Other countries
is
in Europe
the
look
decline of the
down on the United
hospital,
States and wonder
not
how we
only
can be
as an
so
institution
primitive
for the
in our
delivery of
healthcare
medical and
delivery
hospital
system.
care services, but also
Hospitals
the
in the black
decline of an
community
institution
pay more
that
of a
was a
price
part
from these
of the
changes
black
in these
community
efforts.
in so many other different kinds of ways.
History of African Americans in this country must be told, and it must be told over and over again so that our young people can have something to grab hold of.
Moses, Moses, don't you let King Pharaoh overtake you. Moses, Moses, don't you let King Pharaoh overtake you. Moses, Moses, don't let King Pharaoh overtake.
For most of American history, Black and white America have created and maintained separate and parallel institutions in nearly all segments of society. Healthcare was no exception.
Chariot car is some to really understand Homer Phillips Hospital, you have to know the story of.
First of all, one has to recall how the country was at that time. Our society was strictly segregated at all levels. We were riding in separate railway compartments on trains. We
In 1977, Nathaniel Wesley, a noted medical historian, was commissioned to conduct a study of Black health delivery systems in the United States.
So from 77 until about mid-80s, I collected data, I collected information, I talked with persons who were very critical to the development of those institutions.
In his findings, he categorized the 100-plus-year history of Black hospitals into 5 developmental stages: the segregation era, the search for respect, the integration movement, the civil rights years, and the struggle for survival.
Just about every encounter that we had at that point in history was a segregated encounter with white people saying distinctly, you are inferior and that you can never be a part of us. That was the mood of the country that had been that way since slavery and Reconstruction.
The movement to create a national network of Black hospitals and nurse training schools began in the 1890s and peaked during the 1920s. This was the era of segregation, the era of entrenched institutional racism.
My mother died in the basement of a white hospital, poorly lit, dank, and smelly, on an open ward where men, women, and children were all hospitalized together. And I can never forget the feeling of sadness that I had as a little boy when my grandmother used to take me there to visit my mother, who was quite ill. She died there.
Black hospitals were created during the era of segregation because white hospitals would not provide health and hospital care to the black community. There were very few white hospitals that would do that. These hospitals, the black hospitals, came aboard as a way of providing at least a modicum of healthcare services and hospital services to the black community.
Plessy versus Ferguson, the Supreme Court decision of 1895 that in fact mandated the separate but equal doctrine, I think drove that development. That was very, very key there. Secondly, the Flexner Report of 1910, which eliminated 5 of the 7 black medical schools that existed at the turn of the century, I think had a significant impact on hospital development. And then through the teens and into the 20s, the National Medical Association became quite interested in supporting black hospitals because remember now, we didn't have black administrators. Black physicians ran those hospitals, managed those hospitals, provided services there.
Search for Respect, doing from 1923 to 1945, is when you saw a dramatic increase in the number of black hospitals to grow around the country, particularly in your southern states.
It covers the 30s, where President Roosevelt brought in the Social Security era and Social Security payment. Blue Cross was founded. So a lot of things happened there.
This is the time period in which blacks pooled their resources to establish hospitals, or philanthropy organizations provided money to help with the establishment and or development of black hospitals.
The Roosevelt Foundation, which happened to be the Seals and Roebuck people, believe it or not. The Duke Endowment, which poured tremendous amounts of money into hospitals in North Carolina. And incidentally, North Carolina had the greatest number of Negro and black hospitals over the years. And the tobacco money really funded that. So the Duke was putting money in. And also the General Education Board, which were the Rockefeller family, which of course we know founded Spelman, but they put just a lot of money, a lot of support behind the development of black hospitals.
You had the rise of the National Medical Association, which started prior to then, but it began to exert its influence during this period. You had the rise of the Black Hospital Association that began to exert its influence during this period.
It was a matter of knowing that we had great institutions. They were growing, they were being developed, and why can't we be recognized as quality institutions?
So from 1923 through the 1940s, you had an era in which the black physician pretty much came into his or her own. You had the rise of black nursing, the black nursing profession as a profession. So this was an excellent period for blacks to begin to show that they could accomplish things. The self-respect, the training, the discipline, and so forth. The integration era, I start in the mid-1960s. At the same time, you had a noticeable decline in the number of black hospitals in this country.
We lost more than 60 or 70 of our hospitals.
The question is why? What happened?
We had white flight, and then we had black flight.
I think there are two explanations in my mind that can be used to explain the decline of the black hospital. One has to do with federal law, which declared segregation and discrimination unconstitutional. What that did was open the door for the black physician to now carry his services to hospitals that prior to he was excluded from.
Everybody was so pleased and so excited about, we can now go to Provident Hospital, we can now go to Flowers Fifth Avenue, we can now go to Georgia Baptist Hospital.
These hospitals were perceived to have better equipment, better technology, and of course, if something has been denied to you over the years and the opportunity presents itself for you now to expand your trade and move to these institutions that at one time were not open to you, you do that.
Particularly after the war, there was a more liberal spirit and more liberal practice insofar as the training of black physicians, so that black physicians had access to advanced training at the institutions other than the three major ones, such as Homer Phillips, Providence in Chicago, Freedman's in Washington, and Meharry in Tennessee.
So the black physician began to admit patients to white hospitals, but they admitted patients for the most part who had the ability to pay or who had insurance, who were members of commercially insurance programs. As a result, these paying patients who at one time could only go to black hospitals were sources of revenue for black hospitals. So that source of revenue was now gone. It went to the white hospital.
What that meant is, as we moved there, we neglected and we deserted our own institutions.
Black hospitals then were left with the poor, the indigent, or those who had insurance through government programs like Medicare and Medicaid. These programs were not able to sustain the continuance of black hospitals. They were faced with individuals who could not pay their bill, or they were faced with government insurance programs whose reimbursement rates were not high enough or did not offset the cost of care.
Some hospitals were integrated in through civil rights movement. Others were integrated out.
That's one explanation. The second explanation has to do with the attitudes of the black community. I mentioned the black physician earlier. I think the black community also took on the attitude that if it's white, it had to be right.
This affirmative action and equal opportunity permeated our governments, state, local, and federal, into the early 80s and to the late 80s. Then there was black flight.
They began to go to the white hospital to receive services, hospital care, or what have you. As a result, again, moving the revenue base from the black hospital now to the white hospital.
That's the black flight. It had a more devastating effect on these hospitals than white flight.
We have to take some responsibility for our own actions and our own behaviors. And in this case, I think the black physician as well as the black population has some role to play in the decline of the black hospital in this country.
In 1971, there were about 7,500 hospitals in this nation. Today, it's less than 6,000. So all hospitals have suffered, but my point has always been hospitals in the black community pay more of a price from these changes than any others.
What I saw was a big modern hospital, and I can't remember how many beds Homer Phillips had at the time, but it must have been over 400 beds, maybe 500 beds. We had an intern staff of about 32 doctors and whole house staff approximating 100 doctors. All black, all teaching each other, all providing for the health needs of the black people in St. Louis. Having a wealth of clinical material to work with. Blacks are, because of the conditions of poverty, et cetera, and poor health care and a lot of other things, we're not as healthy a group of people as their white counterparts. And so as a result, we saw more diseases that are associated with poverty and with minority ethnicity. We saw a lot of cancer in advanced stages because blacks didn't have access to early diagnosis and treatment.
I remember those cases and also the cases of advanced tuberculosis, where a person may have had tuberculosis for over a year with no medical treatment. And we saw them. They were so far advanced that there's nothing you could really do but hospitalize them and hope that some of the more radical methods of treatment, such as thoracolplasty, pneumothorax, and so forth.
Oh, death in the morning, oh, death in the morning, spare me over and another year. Well, death walked up to the Santa gate. The bleeding have waited now.
Prior to 1900, black patients were really treated in segregated institutions in the city.
You must remember that the blacks were could not be served in restaurants, could not stay in hotels, could not go to movie theaters. The residential segregation was very tight. The schools were segregated.
As little as is said about it, there weren't many options for black kids finishing medical school. The two medical schools were Howard and Meharry. And I think there were only about 4 or 5 hospitals in the country where they could get an internship and be welcome at least. It was Harlem in New York, Homer Phillips in St. Louis, Providence in Chicago, Providence in Baltimore, and another little hospital called Kate Bidding Reynolds in North Carolina. I think there were only 5 hospitals that you were welcome. And as a result, most of us went to one of those 5 institutions.
Homer Phillips was an odd exception in the sense that black people in this community, particularly in the legal and the medical community, had forged a compromise with the white community to build a hospital for indigent black people who then were receiving very inferior treatment in most of the hospitals that admitted them in any capacity.
Homer G was dedicated with a parade in 1937, providing the black community here for the first time with adequate care. It's named after attorney Homer G. Phillips, who fought for it, but who died in a mysterious street shooting long before it opened.
When the hospital opened, it was a tremendous big institution. It had 600 and some beds. I mean, you came from something with a shack to a palace. And everybody, when they drove by it, when they looked at it, they felt that this is mine. So with that in mind, you have to understand what transpires later, because it was not just a hospital built by somebody for black people. It was the product of black movement in this community.
Not unlike nearly 500 facilities throughout the country, Homer G. Phillips Hospital grew out of a segregated medical care system. It soon distinguished itself as an outstanding jewel within the system, and house staff drawn from black medical schools brought invaluable skills and immense sensitivity. It flourished.
Now we come to the hospital. It's open, it's functioning. You've got a big family that's together and what their purpose is. Number 1, to take care of indigent patients. Number 2, to train black people. And number 3, to supply economics to this community, which it did. The number of people who were hired to sweep the floors, the number of people who cooked, the number of people who did the laundry, all of that. It was a big financial boom to the black community. So again, we've got money, we've got pride, we've got everything tied into an institution. Not many like that in this whole country, believe me.
Homer G. Phillips provided that sense of pride, that sense of community, that sense of accomplishment, that sense of being there, when we need you?
It was an all-service hospital. We had all the residencies available: surgery, medicine, pediatric, ophthalmology. So we were a full-service hospital.
It was the largest center for training of Negro physicians in the country.
The whole driving force at Homer G was excellence in taking care of patients. That was the main thing was excellence in taking care of patients, because we knew that we were black, and we knew that going into the world which was changing, that we had to be better than the white surgeons. We had to be better. We had the things that they could do and the errors that they could make. We knew that we were not going to work with.
As the quest for integration gained momentum, white institutions often lured away the best talents from black hospitals. Confronted with diminishing revenues and diminishing pools of talent, black hospitals faced an uncertain future across America. In St. Louis came concerns about the survival of Homer G. Phillips.
Let us see some tangible evidence of replacing of key personnel in Homer Phillips Hospital. Let us see these people come to work there, hire these people. And then this is the only real method by which we can judge the pronouncements of men.
It served some purpose in the early 40s and 50s, and then as integration gradually crept upon us, its usefulness began to decline.
Around 1950, there began to be rumbles of blacks sort of losing their ability to hold on to Homer Phillips. But even before then, we noticed that white residents from other hospitals around St. Louis would like to come to our ward rounds because they saw so much pathology that they didn't see in their own hospitals. And a lot of our visiting faculty were professors from the white medical schools, and I think they would go back and tell their students. And as a result, they sort of wanted to start opening up Homer Phillips to white residents from the other hospitals, and we resisted it strenuously. We said, we can't go there. Why should they come here? And that was the beginning of a lot of strife, and I could see when I left there that things weren't going to go too well, and I left there in 51.
It was not satisfying the purpose for which it was originally set up, and that was to educate black physicians and nurses, because black physicians could go anywhere to any of the hospitals. Previously, we had doctors who graduated from Harvard and the big, the big schools out east, Ivy League schools, come to do their internship and residency at Phillips. But that was no longer happening.
The hospitals and the universities were opened up to us, and many of us went to those hospitals to do training. My training was under Washington University. Many other people went to other places. So hospitals like Homer Phillips had a hard time getting quality physicians to come to their aid.
We took 1,000 consecutive cards out of the receiving room files of Homer Phillips Hospital to determine from where did these patients come and how did they come. And this is the information. 770 of these 1,000 people came from the Homer Phillips area by private conveyance, which meant that it was their choice to come.
They tried several years to close this hospital. Every time the budget came up, it seemed to be Homer Phillips Hospital closure.
Now, this seems to me to indicate that the people in the Homer Phillips area, when they have the choice, and I think you'll have to recognize that private conveyance gives an individual a choice. 80% of the people choose to come to Homer Phillips Hospital. And we had 5% of these people seen in our emergency room came from the city hospital area. So I think you have to weigh very carefully rumors and statements and find out exactly on what are they based. Are they on conjecture, rumor, or are they based on fact?
Even back in the time of Adam Clayton Powell, I can remember so well when that man came here and said it'd be a public disgrace to close our hospital. He said, you got to walk together, children. We got to pray together, and don't get weary. I'm a Baptist minister, and I'm for you all the way to keep this hospital open.
The threat of closing Homer G. Phillips Hospital was so great to the Northside community until we felt that we had to enter into this discussion.
Community activists like myself became involved in this issue. We started speaking with and meeting with the staff, with civic and religious leaders, around the initial concept of trying to assure adequate funding for the annual budgets for this facility. And eventually, that involvement led to the mobilization of the community, labor, church, and community to try to prevent the physical closing of the facility.
I can see us at the mayor's office.
The Committee to Save Homer Phillips tried to meet with the mayor today, hoping to work out a new agreement. They were unsuccessful. Mayor Conway, though, will hold a meeting with his administration to assess what happened today and what its next step will be. This is Cynthia Todd, Channel 5 Eyewitness News.
I can see press conferences that are being held. I can see clergymen leaving those press conferences and pledging that they will really form a body chain that will not permit the hospital.
A couple of hundred North Side residents, civic and religious leaders marched on the hospital they hope to save tonight. Organized by the African Methodist Episcopal Church, the protest group argues that Homer Phillips is needed for the stability of the neighborhood, jobs, as well as medical care.
We think that the Homer G. Phillips proposition is one symbolic of a nationwide denial of medical services for black people. As a black church, we must demand that black people be given their jobs for their taxes, given medical care for their services, and to be given the same respect and the same stability as the rest of this city. In this particular city, we are concerned as a church to serve as a catalyst to bring forward that support to get to the decision makers through demonstrating and through lobbying and through voting, that we will in fact demand that this hospital stays here to service this community.
The Board of Estimate and Apportionment is awaiting the final details of the consultant's reports on consolidating the city's health services. The issue then goes to the Aldermanic Ways and Means Committee before going to the floor of the Board of Aldermen, where a big battle is expected. It looks like the final decision on the big controversy is at least 2 to 3 weeks away. I'm Tom O'Neill, Channel 5 Eyewitness News.
I can see people camping outside on the hospital grounds, trying to make sure that the hospital isn't going to be closed.
It's a hard sacrifice. And you know they think that we're going to give up. They think we're going to get tired. Homer G. Phillips is one of the most outstanding institutions that we have.
It was a political issue. They fought, and they fought, and they fought.
Finally, in 1979, with experts recommending the closing of one of the city's 2 hospitals, Mayor Conway agreed that the one closed should be Homer G.
We will begin the planning necessary to consolidate all acute inpatient care services at Max Dartloff Hospital.
Morning, oh, death in the morning, oh, death in the morning, spare me over and another year.
It broke our hearts, but we done everything that we possibly could at that time to save it. So it was a sad day in the life of St. Louis when Homer G. Phillips Hospital was closed.
They closed Homer Phillips Hospital. It was one of the sad days. You would have thought you was in a war. The mayor had helicopters flying over the hospital, had policemen riding horses and dogs, and people protesting, screaming and hollering and crying, because we knew this was our heritage. We didn't want it to go. But it was something like a civil war.
The demonstrators were hospital employees and patients. When moving vans rolled up to Homer Phillips this morning, they formed a human barricade to a hospital entrance. They wanted to stop the moving of equipment from the hospital to other city facilities.
I didn't know anything had happened. I was on my way to work and was met
by a policeman with a nightstick to turn me around from coming in to the hospital to see the patients. And some of the parents were coming when they heard something was going on at Homer Phillips to see about their children. And they were not allowed to get in, and some didn't know where their children had been taken. They had just been taken from those that were on the pediatric ward, and those in the nursery had been taken down to City Hospital. The other patients who were still in the hospital had also been taken by ambulance. And the type of force was just unbelievable, with the horses, the dogs, the riot sticks. But they were determined to close the hospital that day, but the force was just unbelievable.
Really, there was no force at all used. I mean, obviously, if there was any force, it was only because there might have been some protesters who might have put themselves in the way of people who were charged with carrying out their responsibility.
The thing that infuriated us more than anything else was, after all of the effort, having met with the mayor and so forth, they brought dogs to Homer G. Phillips Hospital and the police department on the day that they said that they were going to close the hospital, and then bragged about it, how easy it was for them to close that hospital.
Death in the morning, oh, death in the morning, oh, death in the morning, spare me over and another year. Well, death walked up to the Santa's gate. To believe you have waited now a little too late. Your feet were not 102. Have a narrow chance if you ever put through the cried
After the hospital was closed, there was a massive 6 to 7 year campaign in this city to reopen Homer G. Phillips Hospital.
The Homer Phillips supporters stopped their procession on Skinker, then walked up Westminster to the home of Mayor Vincent Shamel, and they were carrying a symbolic casket. The demonstrators said the casket they carried contained the mayor's broken promises concerning the reopening of Homer Phillips.
It was so plain that he was playing only lip service to us when he said, I will open Homer G. But when he went through his marathon budget hearings, he didn't put one penny in that hospital, in that budget for the hospital, not one penny.
Our God is a rock and weary land, weary land, weary land. Our God is a rock and weary land. As the years passed, the possibility of reopening Homer Phillips faded. The building that once housed this jewel in history still stands, while the once vibrant community has disintegrated. The impact of the closure has reached beyond health care.
There used to be shops, restaurants, and little stores all through the Ville area. The first high school west of Mississippi, which is Sumner High School, was built there. The first brick building, built by black money and owned by a black woman, the Poro building, was built there. The first orphan home for black youngsters west of the Mississippi, Annie Malone, was built there. The first school for handicapped youngsters, which was Turner Middle School, was built in the Ville. And the first hospital built for black people, run by black people, to serve black people, was built there, which is Homer Phillips Hospital, was right there in the Ville. But after they closed the hospital, those stores and those shops dried up because of the economics of those 1,000+ people that worked at Homer Phillips. It was more devastating than to just take the health care away from an indigent population. But they also took a viable economy away, which was jobs and businesses.
Much of the energy, much of the economic vitality there in the Ville neighborhood was sucked out like so much air out of a balloon. Our commercial district suffered. There was a proliferation of abandonment houses that suddenly, which had been vibrant and homes to many families, suddenly became empty. You see, the hospital was a key economic cog in the engine there in that community. And so when it disappeared, it had an ancillary effect that still to this day is being felt in many respects.
20 years after men, women, children, and machines were moved from the building, Zenobia Thompson, a graduate of Homer G. Phillips School of Nursing and former staff nurse at that hospital, took us on a journey behind its closed doors.
Why? The first time I was on this floor, I was 18 years old. And that was in 1962, my first year as a student nurse. It was really amazing. I felt so proud to be a part of Homer G. Phillips. I mean, everybody in the community is proud of Homer G. Phillips nurses. And I was very proud. I felt very proud to be. Well, we're on our way up to the 4th floor. That was the maternity unit. And many babies were born, and mothers were here on the 4th floor OB, Homer G. Phillips. This is one of the labor rooms in the delivery suite. It had 2 beds, one on each side, had a little stand where you could keep water or whatever, and many times you took care of your patient right here. This room makes me remember the day I was on duty, and we had a real serious case, and the lady had no vital signs. Dr. Smiley came in. At that time, it was determined that the lady's vital signs were gone. He asked for a knife and took that baby out of that lady's womb right here in this room, and that baby lived. They later found out that she had an aneurysm had ruptured, and there wasn't no way of saving her life, but Dr. Smiley saved that baby, and that was remarkable. That was had seen many remarkable things at Homer G. Phillips Hospital, but that was one that really stands out, and I'll always remember. I mean, it was absolutely phenomenal. Right here in this very room, the bed was over there, and it was such a hustle and bustle. But we were used to crisis. I mean, crisis was normal for people who worked at Homer G. Phillips Hospital.
We had approximately 400 deliveries a month, and that was more deliveries than any other hospital in the city of St. Louis. And these were indigent patients.
We had 10 deliveries a night. I mean, we had so many deliveries, we'd have to, when someone delivered their baby, and we was done with the delivery, we give the lady her baby on her stretchers, and then you hold on to your baby because we'll move you right here and move somebody else in. Now you hold on to your baby.
One of the leading indicators of healthcare back in the 40s and even now is the rate of infant mortality, especially in high-risk groups like African Americans living in the inner city. And what's quite impressive reviewing the public health documents of Homer G. Phillips Hospital is the low rate of infant mortality. This is an index of the level of care by our obstetricians and the gynecologists, and again, it's just an index of the overall standard of care afforded to that community.
This is the operating C room, which is one of the main operating rooms. There were two that surgery was performed. Geez, this room would be bustling with people. Doctors, interns, nurses, anesthesiologists. This was a very learning room, and it's a very caring room. As Dr. Mitchell used to say, sometimes they would cheat the Grim Reaper because many lives were saved in these four walls.
A lot of the surgical services and the emergency rooms just worked. I remember the first night I worked on a surgical service, and I looked up and the sun was coming. I said, I'll be damned. I worked all night. And this was very common, very common. But you didn't mind because there was a lot of not monetary reward, but personal satisfaction for knowing that you were becoming a very good doctor and becoming skilled at what you knew how to do.
Money was not an item, but the important thing is that nurses worked overtime. There was no 8-hour schedule. You worked until you finished, until the patient was stable.
If you're really sick unto death, or if you're hurt, or you're shot, or you're in a bad accident, the best place to go was Homer G's, because we believed in emergency services. We had a terrific emergency department. We had physicians. We had doctors who could really do their stuff. They really knew their business. And when I left there was no doubt in my mind that I was a good surgeon.
It was not uncommon for me on a Friday or Saturday to have 3 or 4 victims of shootings, and I would always take them to Homer Phillips because I knew that that trauma staff that they had there were the best. And I just don't recall anyone that we ever took in there alive dying. Now, they might have been, but most of the time, they were able to save those individuals. And I thought that was just extraordinary that a hospital was able to do the things that they did. I recall us using the radio to notify Homer G. we're coming in with a serious gunshot wound. And when we arrived, they were there in the driveway with the gurneys, the doctors, the nurses, the team waiting to start working on these individuals. And I think that's a credit to that hospital because they took that job very, very seriously, and they did an excellent job. And that's the thing that struck me more than anything about that hospital.
When I was rushed to Homer G. Phillips Hospital, I was shot 4 times. And most of the people in St. Louis that are around today still around, they know that. And my injuries were in my right leg, left leg, right hand, and in my abdomen. And through all of that, I survived it. So you can't say that there's not a God above, because between God and Homer G, I'm here.
That hospital was the best, even to the point that most African American police officers would say, if something would have happened to me, you make sure I get to Homer Phillips.
It was a very, very busy place, but yet they did a pretty good job.
The unselfishness and the vision and the dedication of that small group of physicians who made it possible for all the others of us who came along. I don't think too much could be said about that, and to me that is the core of the human experience.
We love you, proudly because we are part of you. Since the world must suffer, teach us to discover all of the best ways of serving. Make us be humbly deserving. Help us to nurse the nightingale way. Homer G. Phillips, we pray.
It's sad just to think back over the years that this institution was a pillar of the community, the heart of the community. And look at this community now. Just unbelievable that I will be standing here today looking out from this institution and reflecting on the community that it used to be, that it once was a viable community, full of life, full of wonderful, wonderful things. And now today, we have an empty shell of a building that holds the memories and the history of so many marvelous, wonderful people. It's also painful and it just really hurts. Just say.
The battle that we fought was a very, very good fight because we found that throughout the United States of America that there were public hospitals that were closing right and left and leaving the same problem that exists within the St. Louis community today. There are a lot of very poor people, and unfortunately, those who are African Americans who are falling through the cracks, who are not receiving the health care that they need. And this still is a deep concern for this community as such.
2 decades after the doors of Homer Phillips were closed, the city of St. Louis, and indeed cities across the country, still wrestle with care for its indigent, its uninsured, and its underinsured. Minorities bear the brunt of a failed national health care system.
The closure of Homer Phillips was symbolic of what had happened to a lot of predominantly African American hospitals. They were more than just a hospital. It was almost a central social focal point for the community. It served to educate a lot of Black Americans in the health sciences. I don't believe the country then or even now fully appreciates the contribution that these institutions made. They were victimized by the healthcare dynamics of the time. It was financial, even though they were supported by churches and the community at large. They had no large pools of financial resource to keep them going. And I don't believe that the country still realizes what a bargain these hospitals really were.
There are too many people in this country getting no care. The private hospitals are not taking these people in. If they don't have Medicare or something, they give them some medication and get rid of them. The quality of care in America now is less than what it was when I was in the field.
Even though very, very wealthy people or people with very, very good insurance can get excellent health care, the vast majority of the population, and probably about 50 million people, don't really have any adequate health care system at all. And this is a dire tragedy, and it's a shame. This country is a disgrace in the world. Other countries of Europe look down on the United States and wonder how we could be so primitive in our healthcare delivery system.
The U.S., of course, has the best healthcare system in the world, but the best for whom? It is the best for only those who are able to afford it. That's where our problem is. And the U.S. is one of the few democratized countries in the world where you end up with what I refer to as a 3-tier healthcare system. That first tier being the healthcare for the rich and famous. That second system being healthcare for those who are insured through commercial insurance programs. And the third tier being health care and hospital care provided to government-sponsored insurance programs, Medicaid, Medicare, and what have you. As the most prosperous democratic nation in the world, why should this country subject its citizens to inadequate health care? And this is to include African Americans, the poor, and the indigent.
There is a need for institutions who make it their primary mission to care for underserved communities.
We've been left out of the textbooks, and we need more historians to get involved in these things because we don't want these people to die who had these positive and bad experiences without them being recorded.
Homer G. Phillips, we love you proudly 'cause we are part of you. Since the world must suffer, teach us to discover all of the best ways of serving. Make us be humbly deserving. Help us to nurse the nightingale way. Homer G. Phillips, we pray.
Homer G. Phillips, we love you proudly 'cause we are part of you. Since the world must suffer, teach us to discover all of the best ways of serving. Make us be humbly deserving. Help us to nurse the nightingale way. Homer G. Phillips, we pray.